Welcome to Global Health Science Study Series. So today I'm taking you through electrolytes. So electrolytes are minerals that carry electrical charge when dissolved in a body fluid. Just as simple as that. Then we see that they have got functions in our bodies. So major functions is to maintain acid-base balance is one of the functions. We also see it maintains the nerve functionality in our bodies. We also see these electrolytes help in maintenance of muscle contractions. Then on the other side, we also see they are majorly essential in cardiac activity and maintenance of acid-base balance. This is majorly significant with phosphates and bicarbonates. Then we're going to talk about that they're majorly classified into two. So we have what we call a classification based on location, where we are going to be looking at intracellular and extracellular electrolytes. So being extracellular or intracellular means there are those that stay inside the cell and there are those that predominantly stay outside the cell. Then looking at the ionic charge is another classification. There are those that are positively charged and there are those that are negatively charged. So allow me give you a list of those that are positively charged and those that are negatively charged. Now, negatively charged are called anions, or you can call them anions, and they involve bicarbonates, they involve phosphates and chlorides in particular. Then you also see those that are positively charged involve magnesium, they involve calcium, and they involve sodium. So those are the major four. Then looking at those that stay inside the cell and they are positively charged. That means intracellular cations majorly include potassium and magnesium. Those are the intracellular cations. Then the extracellular cations majorly include sodium and calcium, those two. Then looking at the anions, we have what we call the intracellular anions. So intracellular anions majorly are the phosphates. Then looking at the extracellular anions, the extracellular anions here involve majorly the chlorides and the bicarbonates. That is to introduce you into what we call the electrolytes. That's by introduction. So let's just go ahead and talk about the clinical manifestation of patients presenting with electrolyte imbalance. How do those patients present when they have electrolyte imbalance? So allow me to start with sodium. What happens if the patient is having a sodium imbalance, which can be hypo or hyper? That means low levels hypo and high levels hyper. So in so doing, allow me give you that when the patient is having low sodium concentration, remember sodium is an extracellular electrolyte. That means it balances the fluid concentration outside the cell and the osmolarity outside the cell. So in so doing, you realize that once there is low concentration of sodium outside the cell, remember it's balancing together with the potassium inside. So potassium is inside and sodium is outside. So they are all balancing the osmolarity. That means the fluid concentration inside and outside the cell. So now, once there is low concentration of sodium, that means that the concentration of potassium will surpass the concentration of sodium. Now the fluids or the water will be forced to enter inside the cell by osmosis, which is the movement of molecules across the semi-permeable membrane in order to balance the equilibrium. So you realize that inside the cell there is high concentration, outside the cell there is low concentration. So movement of molecules from the region of low concentration to the region of high concentration, now leading into swelling of the cells. And once the cell swells, in other words, now imagine it is a brain cell that have swollen. So you realize that this patient will have a headache, will have a confusion. This patient will also be lethargic. That means sick looking and majorly sick looking. Yeah, the patient can also have seizures. That means convulsions and potential cerebral edema. Then we also see what if our patient has got high levels of sodium. So once the patient has got high levels of sodium, just like the other one, so there will be movement of molecules from inside the cell outside, leading into cell shrinkage. And once the cells shrink, so this patient will present with excessive thirst. You also see these patients' mucous membranes dry. And then you also see our patient, maybe if these patients have also potassium imbalance. What will present with patients having potassium imbalance? Now, look at potassium at its high level, which is called hyperkalemia. So when a patient is having high levels of potassium, remember, potassium is an intracellular electrolyte. So in so doing, it is majorly, its major function is to help in the functionality of the internal homeostasis. It's an intracellular cation that plays a big role in muscle contraction and heart cardiac activity. In other words, the heart muscle activity, because it helps majorly in repolarization and polarization of the cardiac muscle. And its deficiencies can actually result into various changes in the patient. For example, in hyperkalemia, you realize that the patient will have arrhythmia. Then on the other side, if the patient is having low concentration of this potassium, the patient will have a weak heart muscle activity. So that is the basics about potassium. And well, so when you look at magnesium, magnesium has majorly a reference range of around 0.7 to 1 millimole per liter. So magnesium has several other factors, and I want you to understand that magnesium is both an intracellular and extracellular cation, and majorly it has its impact in cardiac activity. It has its impact in enzyme activity because it's a cofactor in enzyme activity. Then you also see it helps most in energy metabolism. So it can also have a deviation which can be called hypomagnesemia, or it can be hypermagnesemia. That means low levels and high levels respectively. So it is low levels can majorly hamper a lot, leading into muscle weakness, and can also lead into poor enzyme activity, as I told you. Then of course cardiac arrhythmia. That means there will be uncoordinated heart rhythm. So you also realize that magnesium is majorly gotten as in dietary form. That means you just eat it and it gets access to your body. So just to let you know that there could be causes leading into low magnesium concentration in your body. That could be related to severe diarrhea. Of course, majorly severe chronic diarrhea can lead into loss of magnesium. We also see majorly feeding habit. If you're eating foods that are less concentrated with magnesium, of course, you also have low magnesium concentration. Then, of course, you also see certain medications that can be taken that can hamper the absorption of this magnesium in your body. So, then, of course, we can go ahead and talk about the other one. The one more other cations majorly like calcium. So calcium also has its own mechanism through which it is really effectively working. Very important in bone mineralization and bone strengthening, and of course taking part in bone formation. Then that means that it has its activity majorly on the muscles, and of course on the other side you also see it is deficiency can lead into neuromuscular excitability. Then majorly, just to let you know that its low levels is called hypocalcemia, and its high levels is called hypercalcemia. And so the normal reference ranges for calcium majorly range from 8.5 milligrams per deciliter to 10.5 milligrams per deciliter. But these ranges are majorly dependent on your laboratory setting, so it shouldn't be a fix. So you are liable to change and adjustments based on your laboratory setting. And now I'm taking you to the anions. Anions are majorly the negatively charged electrolytes, and in so doing, allow me to take you through one which is majorly called phosphates. So phosphates are majorly important in a way that they help in ATP production, then of course DNA synthesis, and the other side we also see bone mineralization, and it also helps as an intracellular buffering system. So just to let you know that it can be elevated or it can be low. So its elevated level is called hyperphosphatemia. Then its low level is called hypophosphatemia. And ranges, which is majorly from 0.8 up to 1.5 millimoles per liter. That is for the phosphate. So while we are still looking at our anions, and now we are looking at the bicarbonates. Bicarbonates are majorly the body's extracellular buffering system, and is a major buffering system that helps in maintenance of the acid-base balance in your body. That's a major significance of these bicarbonates. So their low quantification or high quantification also can result into different deficiencies in one's body. So it is low concentration is called hypobicarbonemia. So, well, when we start looking at the bicarbonates, these are the major extracellular anions that majorly help in the buffering system of the body. In other words, to maintain the alkalinity and the acidity of the blood. So, high concentration of these bicarbonates majorly lead into alkalinity in blood, and what can lead into such is when there is maybe like metabolic acidosis and sometimes certain kind of poisons that will end up utilizing the bicarbonates in order to buffer them. Then on the other side, if you find these carbonates elevated, this can be resulting from what they call metabolic alkalosis. So, most important considerations when interpreting electrolyte results. One, these results are always interpreted not on isolation, but they are majorly interpreted in relation to laboratory reference ranges, which may differ from one laboratory to another. Then also we interpret these results in relation to renal function test results, because some of them are majorly affected by the functionality of the kidney. Then on the other side, we also look at the patient's treatment profile as we interpreting the results. Maybe the patient is just out from an IV infusion of normosaline, so you'll find when they're always fluctuating levels. Then also we also interpret these results in relation to invasive procedures done on these patients. Maybe the patient is just out from gastric lavage when they have just removed some contents from their stomach, so it will always affect majorly on the ability to interpret correct results and understand them. We also interpret these results based on a patient's medication profile, because certain medicines sometimes interfere with absorption of some of these electrolytes. So those are the major considerations that you're going to consider when you're sitting down to interpret these laboratory electrolyte results. Thank you so much. If this learning has been so profitable to you, I would request you to like, share, and majorly join the family by subscribing. Thank you so much. Your global